coronavirus to have larger impact on global economy than SARS. IHS market the outbreak of coronavirus will have a larger negative effect on the global economy than the SARS severe acute respiratory syndrome outbreak in 2003, as any slowdown in Chinese economy would send not ripples but waves across the globe. Travelers from China, Korea, Italy and other affected countries could spread COVID-19 to the MENA region. The virus has already spread to Iran and other MENA countries. Because of their exposure to oil and gas exports, a decline in the prices of petroleum-related products is expected to be the most significant channel through which effects of the COVID-19 are felt in MENA countries. COVID-19 is likely to reduce tourism from China to MENA in two ways. The first is the pull factor. Many MENA countries are now imposing travel restrictions on Chinese people. In addition, Saudi Arabia suspended entry of pilgrims to the holy sites, further reducing tourism to the Middle East. The second is the push factor. Economic slowdown in China implies fewer tourists traveling to other countries, including MENA. The East Asia and Pacific region is likely to see the sharpest drop in Chinese tourists. The effect of economic slowdown in China on tourist arrivals to MENA is expected to be more limited. But the reduction of global travel will further depress oil prices. Impact of the coronavirus pandemic on the world economy and how India is placed. The mystery behind India's lower death rates from the COVID-19 infection, and say that India is bucking the coronavirus trend. One talks about the Indian exception as death rates in major Indian cities are lower compared to global coronavirus hotspots. Early 2 months after its first recorded case, COVID-19 infections in the world's second most populous country have passed 29,451, with more than 939 deaths. Government says plasma therapy in trial stage. One way to understand the death rate is to track how many days it takes for total deaths to double. Experts say that's good news. The doubling time for deaths in New York at the same stage of the pandemic was only 2 or 3 days, they say. Many public health professionals and doctors say India's grinding lockdown, which lasted more than a month, could have kept infection and deaths in check. The International Monetary Fund (IMF) has revised its global GDP growth estimate from 3.3% just 3 months ago to a contraction of 3%, something not seen since the Great Depression of the 1930s. ET Wealth studies how India is placed in this scenario.